A question just came in, and I think this is really a good question for you. Is diet after being diagnosed with prostate cancer any different than the diet from a diet that you would use to prevent prostate cancer?
Great question. I don't know if I have a specific answer. I think the overall goal, and this dovetails on a lot of what Dr. Powell said, is really working on anti-inflammatory properties and antioxidant properties in the diet. There's a role now for glutathione. There's a role for a lot of different antioxidants. And we believe that those things can make a difference.
So the answer is we just don't know. Fair enough?
Fair enough. But I think, probably we're probably more in tune with adhering to and prescribing special diets after a diagnosis as opposed to before a diagnosis for prevention. We would hope that's not necessarily the case, but we can probably work to bridge that gap.
Thank you. So my question to you, to carry on with the discussion we had regarding racial disparities, you work at the University of Michigan. So my question is how are racial disparities are being addressed at the University of Michigan, and what do you think are ways to improve healthcare inequalities?
So I'm privileged to have practiced at University of Michigan. I'm coming up on my 22nd year on the faculty, and I've been practicing in Ypsilanti for 21 of those years. And I'm proud to have an extraordinarily multicultural and diverse practice. What is happening at the University of Michigan? There's a lot of attention toward what we need to do to get better. There's a lot of talk about how we engage patients, how we engage each other, how we engage the literature, how we engage teaching, how we engage appropriate discourse of the education that we give each other and the education that we give patients. Dr. Powell mentioned a lot of powerful things. I 100% agree with everything he said. I think the challenge is how we take that into the exam room. And again, oftentimes getting men into the exam room can be a struggle. Once you get them there, Mike, you've heard my lecture, once you get a man, he's your captive audience, now it's on to preventative health. It's all about that. There's a lot that we all have to learn about how to engage all men and avoid racial disparities, but also recognize those things and create that environment where all men can ask the questions and get the answers that they need. I still find it a challenge. I still find it challenge to interpret the literature and present the literature in a way that is welcomed and not necessarily viewed as a racial disparity, but ways that we can talk about the statistics.
Yeah, I think it's important, and we'll find ways to move forward.